No, you only have an hour.
I know.
Did you log in?
I'm working. All right, you should be able to get in now, Tab. Tabitha says my email's showing 2:00.
No, the email doesn't. Yeah, the email says 12 to 1, but it's the, okay, I got you. I'm in. All right, bye. Jesse, are you ready to get started?
Yes, ma'am.
Okay, well, good afternoon, everyone. This is Tabitha Curtis, and I'll be chairing the Franklin County Prevention Coalition Franklin County Health Council meeting virtually today. But I want to thank you all for coming out and joining us this week. I know there's a lot of great things have been happening since our last meeting. So we will start out with welcome and introductions. And if we could, we can start over, I think, to the left. There, we'll start with you, Sophia, and go on around the table, and everybody introduce yourself and tell us what organization you're with.
My name is Sophia Leon Mesa. I am the public health educator for Franklin and Grundy counties. And I work with the Tennessee Department of Health. We cover multiple counties, so we're with the Southeast region.
I'm Delaney, and I'm with Southeast Regional Health Office, Health Promotion Director.
And I'm Amy Davenport, and I'm a health educator and assistant health promotion director for the Tennessee Department of Health, and I'm based out of Bradley County.
I'm Alexis Foster. I am the health educator for both Marion and Sequatchie counties. And I work with home. I'm Angie Boyle with Waters Club of Franklin County. I'm Alicia McElroy, I'm a local ministry at Freedom Baptist Church, starting a life recovery ministry, and I'm also a former foster parent.
Hi, I'm Bonnie Miller, and I work with. I'm Heather Lee, and I work for Health Connect America. I'm Megan Acklin, and I work with GHS Local Reform. I'm Jennifer Baird, and I'm with Franklin County School District Student Advocacy. I'm Vanessa Radley, I'm a partnership unit. I'm Martin, also a partner. I'm Barbara Duhai, with Emperor.
Everybody, I'm Dave Hodges with the Hamilton County Coalition Region 3 Hybrid Lifeline Program.
Alan Burnett, Lifeline, of the Franklin County Prevention Coalition.
So, Feller Younger, also DHS, Winchester.
Archie Custer, Drug and Child Coordinator with the Franklin County Prevention Coalition.
Paula Rose, I'm the Bridge Program Coordinator of the Franklin County.
My name is Justin Owens. I'm a community engagement specialist for system care process.
William Anderson, Franklin County Commission.
I'm Sarah Devon, and I'm in the family office.
I'm Justin Rich, I'm a regional overdose specialist with Franklin County Commission.
I'm Meredith Hugh, and I'm a regional overdose prevention specialist through the Franklin County Prevention Coalition.
I'm Cindy Smith. I work for the Camp Cora Family Resource Center.
I'm Laurel Stone. I work with Child Care Resource and Referral, and I'm also part of Isaiah 117 House and Franklin County CAB and the Prevention Coalition.
I'm Melanie Morrow. I'm the Prevention Coordinator for the Franklin County Prevention Coalition.
Hi guys, Jessica Hand, Director of the Prevention Coalition.
Okay, and it looks like we have about 18 people joining today virtually, guys. This is awesome. Not only do you have a full room there, but you have a full audience outside here virtually. We welcome, I think that was Mr. Eric Van Zandt coming in to the meeting. Not to call him out or anything, but glad he could join us there. Hey, Eric. Okay, so if we would, Jesse, this may be easier for you to do there. I see that Patricia Cox, can you go ahead and introduce yourself?
Yes, I'm Patricia Cox. I'm the Community Relations Rep with Amera Group, and I cover the 35 counties in East Tennessee.
Okay, Miriam Field.
Hi, I'm Miriam Field. I'm the founder of a nonprofit called Mainline Harm Reduction, and we serve South Nashville's drug users. We're user-led drug war pacifists who understand that you can start healing before you stop using.
Wonderful. Thank you for joining us. And I know Beth is there in the room today as well. Angie Caulfield.
Hey, I'm Angie Caulfield. I'm with the Franklin County Health Department and I do the CHAMP program.
Okay. Jennifer.
Hi, I'm Jennifer Hennessy and I am with Norris Academy.
Okay, thank you for joining us. We have Kathy Pack.
Hi, Kathy Pack, Franklin County Library.
Okay. Let's see. So maybe, okay, I think I've got him back now. Greg Keeling.
Hi, Greg Keeling with the Department of Mental Health Substance Abuse Services. I am a housing facilitator for the CHI 2.0 Substance Use Disorder grant funded program.
Okay. Miss Elizabeth Paget.
Yes, good afternoon. I'm the Director of Franklin County Life Choices Pregnancy Support Center.
And Tanya McNabb.
Hi, I'm Tanya McNabb from Volunteer Behavioral Health's Rapid Rehousing Program. I'm the Program Director.
Emily Clark. Okay, Emily. All right, we'll go with Rachel Swafford.
Hi, everyone. I'm Rachel Swafford. I am with the Tennessee Department of Health, the Southeast region, and I cover 10 counties, including Franklin, as the Regional Substance Misuse Response Coordinator.
All right, Kelly Ware.
Hi, I'm Kelly Ware. I am the Healthy Development Coordinator from the Southeast Regional Health Office.
Okay, is there anyone that we missed online? I see Sabrina Moore.
Yes, my name is Sabrina Moore. I'm an outreach specialist for the statewide family support network with Tennessee Voices.
Okay. Mandy Easterly.
I'm Mandy Easterly, health educator with A Step Ahead Chattanooga.
Looks like Jessica May has also joined us.
I'm going to speak for Jessica. She is from the Rain Teen Center. She said someone is mowing outside of her window, so she wouldn't be able to hear her.
Okay. Is there any Mary Ann Christian?
Hey, I'm Mary Ann Christian, the South Central Regional Director for the Tennessee Suicide Prevention Network.
So is there anyone else? Katie Kelly, did we get you as well?
No, that's okay. Yeah, Katie Kelly, I'm the clinical supervisor for the Centerstone Mobile Crisis Team that covers Franklin County, as well as other counties in the area.
Thank you for joining us, Katie. Is there anyone else that we might have missed? Okay, if you are joining us virtually, please make sure that you enter your name into the chat box and your organization as well. That way we can have a record of you attending the meeting. I know in person, the meeting there is a sign-in sheet going around. So make sure that you sign into that sign-in sheet. And now I know that you all should have a copy of the minutes from the last meeting. So we'll take just a second to look over those minutes in case you haven't had time to do that. And then we will need a motion to accept those minutes as printed.
I wanted to introduce myself, if that's okay.
Oh, absolutely. I apologize.
Well, I tried to message you in the chat. That's okay. Mine's just a little bit longer. I'm trying to be respectful of our time, but my name's Daniel Patrick Garrett. I started and run Tennessee Harm Reduction. It's a 501c3 nonprofit organization based in Jackson. We do a few things. We run the first and only harm reduction program in non-Memphis, West Tennessee. We also publish research, including policy briefs. For example, like we put out one in August called The State of Syringe Access in Tennessee. We do other research. We gave a presentation at the Southern Harm Reduction Conference just 2 or 3 weeks ago in Atlanta, and that was called The Sad State of High Dose Naloxone. Put a link to both of those in the chat. We also run the state's leading online harm reduction resource. There aren't really any central outlets for sharing drug-related news. And by drug-related, I mean drug prevention, peer recovery support, addiction services, drug policy reform, harm reduction. And one of the ways we can keep up with what's going on across the state is by attending these meetings. So that's a big reason why I'm here. And maybe more importantly than anything else, I'm almost done, sorry.
Oh, no, that's okay.
Maybe more importantly than anything else, I identify as a person who uses drugs. Being a drug user very much informs my work. It helps me understand, or helps us all understand the nuances related to drugs, drug use, and the people who use them. But also federal, state, and private funding sources are increasingly requiring applicants to involve people with lived experience in a meaningful capacity. So involving people who use drugs is, I think, important for all of us, whether that's harm reduction or drug prevention. But yeah, that's a little bit about me and Tennessee harm reduction. Thank you, guys.
Well, thank you for joining us today, Daniel. Okay, then we have those approval of the minutes. If we could, again, make sure that you put your name in the chat box and the minutes. If we could get someone to make a motion to approve the minutes.
Make a motion to approve the minutes.
And if we could get a second.
Archie, second.
Thank you. Okay, so at this time, if we could ask Ms. Jessie Sheehan, the Director for the Prevention Coalition, to give the Franklin County Prevention Coalition update.
So we have a beautiful newsletter that we make every month, and Melanie, I'm just gonna do a little shout out. She works really hard on this. She does a fabulous job. So each of our programs of the coalition has expanded. And so each of our programs has an update page in here. If you want to review that, it is available online through our website. I believe it was in that email that was sent out, and then everyone has that in person.
Jesse, the parent events, are they at the gym?
That we have, that later, I do that now. We have parent events going on next week. We have the one in Huntland on September 26th from 6 to 8. This is a parent awareness night. We're going to talk about social media, some hazards, some drug trends for parents to look out for. We'll have our hidden in plain sight there. And that is from 6 to 8 Huntland in the gym. And then the same thing at South from 6 to 8 on September 29th. That's Thursday. We will be providing dinner at 5:30. If you're wondering, north and south, excuse me, north and FC will be planned at a later date.
I just have to tell you, ladies, I love this flyer and I love how it was created. And also, I think it looks great on social media when it's out there. I've been sharing it. So great job on this.
Good. And I like it just gives us a little more time to discuss other things during the meeting. So please take a look at what we've done and what's coming up. So.
Okay. All right. Sophia, would you like to give the Health Council update?
Yes, ma'am. Our CHA plan is final. Woo, woo. Thank you. For everyone that I emailed and got back to me. Thank you so much. I do have a copy of the 3 areas of focus. I'm going to pass them around here. I can send them out as well via email for those on my online folks. But you should see 3 plans on here for the next 3 years. One is substance misuse, obesity, and mental health. So you should see a lot of activities for the next 3 years for that.
We can get that uploaded on the website.
Okay, sure. Jessie says she can upload that on the website as well for my online folks. So, you guys can't see those yet. Also, I got this from DCS and they wanted me to share with you guys. DCS is having an interview and hiring event. They are needing people in all of these counties listed here. One of those is Franklin County, so I will pass this around. For my online folks, this hiring event will be Thursday, September the 29th from 9 to 7 in Columbia, Tennessee at 1400 College Park Drive, Columbia, Tennessee. So my people in the room, I will pass that around. Also, since we are the Health Council, I wanted to mention about there's a lot of upcoming events related to 5K, walking, walkathons, all of that. So I wanted to mention that. The first one is Tim Ford State Park is having a color run. It's a 5K. That will be November the 12th. We will keep bringing this flyer in here to remind everybody about it. I'll pass this one around as well, but they're having a color run in November. If you can, let's see, Recovery Alive, that's Alan. He's having a walk September 24th at 9 a.m. at Winchester City Park. If you can't make it at 9 a.m., you can always go to Raise Your Voice Walkathon. That will be September the 24th at 5 p.m. at the Bass Club. There's also a Community Healing Day, October the 22nd from 12 to 5 p.m. And that will be at the library. And I'll give you these bets because I'm going to come pretty fast. There's also another walk, and it's called Baby Steps. It's Walk for Pregnancy and Infant Loss Awareness. That will be October the 15th from 5 to 8 p.m. at the FC Annex Building or the old high school. You guys heard about the color run, Fight Flu. The health department, we're having our Fight Flu event on November the 9th. That will be our usual drive-through clinic that we do here in town. Shots will be free. I don't have the times yet because they're trying to finalize those. They don't know if it's going to be from 8 to 6 or just focus in the afternoon like we've always done. But I'll keep you guys posted, and as soon as I get those flyers, I'll send those to you as well. That is all I have.
Lots of opportunities there for physical activity. Lots and lots. Great. Great. Okay, it looks like our guest speaker for today is Jennifer Hennessy with the Norris Academy.
Yes, thank you. Is there a slideshow? I can share my screen if you all don't have it.
I have it if you'll give me just a second.
No worries, thank you.
Trying to make them be able to see you and your slideshow, but I don't think.
Oh, slideshow is more important.
And thank you, Jennifer, for joining us today.
Yes, thank you. Sorry I couldn't be there in person.
No worries.
Got a big group today. This is awesome.
Jesse, how many do you estimate's there in person? I know we have 21 online.
We've probably right at 30.
Okay, that's awesome. There we go.
Thank you.
All right. Thank you, Jennifer.
Yes, thank y'all. Okay, so I'm with Norris Academy. It's a psychiatric residential treatment facility. So it is located just north of Knoxville, Tennessee, about 30 minutes north of Knoxville, right off the interstate. And it's a new location. They've been there about 4 years. I don't know if anybody's familiar with that area, but there is a Norris, Tennessee that it used to be in. Now we're technically in Andersonville, which is about 5 minutes down the road from the old location. But they've been in this building for about 4 years. Go to the next slide. These are a couple pictures as you're driving in. That first one with the pond, there's a fence around it now, but that's kind of what you see in the corner. And then the sidewalk, that's the walkway up to the main doors. So like I said, it is like, you could go back. It is a psychiatric residential treatment facility. We serve males and females. Youth are coming to stay with us. That's what we mean by residential. Our goal is about 3 to 6 months for them to be there. Ages 6 to 17 with a neurodevelopmental diagnosis. Most one that people are familiar with is autism. It does not have to be that. It could be fetal alcohol syndrome, could be Down syndrome. Typically something that's happened in utero or when they were young to cause these behaviors, a neurodevelopmental diagnosis. And then that's also paired with an intellectual disability. So we're looking at IQs below 70, and really for Norris Academy, I would think more intellectual disabilities than thinking about the neurodevelopmental. So typically, you know, we're looking at the IQs below 70 would be most appropriate. Okay, next slide. Thank you. Cover this, intellectual disabilities, IQs 35 to 70. Now, some can be case by case if they are diagnosed with autism. You know, maybe they're nonverbal, maybe they're physically aggressive, physically acting out, but their IQ is above 70, that could still be appropriate. So, but you know, if there's any questions, you guys can call me. My number's at the end. But yeah, you guys could call me or call Norris directly if you have any questions about these. I don't expect you to remember them or memorize them. So a lot of these kids cannot be safely managed at home. Their parents, even at school, the teachers, maybe they've tried alternative schools and it's just not enough for them. Maybe they've been hospitalized a few times and they're trying outpatient care. You know, they've just tried every level of care possible and they're still exhibiting these extreme behaviors. That's kind of when residential comes into play. That's when Norris Academy can step in. And we do work with insurance. It can be private, it can be Medicaid. We do take all TennCare. I do realize we are in the Knoxville area, but we do serve the whole state of Tennessee. We even had kids from out of state. We've got several from Montana. We actually just admitted a kid from Alaska just 2 weeks ago, kids from California. So they really come from all over. Some red flags, you know, some things that we're not able to accommodate are some serious medical conditions. Maybe there's a history of extreme fire setting. Now, if it's been like once or twice or, you know, but it has to be an extreme like habit, fire setting habit, history of extreme animal cruelty, extreme level of delinquency and aggression. A lot of the juvenile justice youth will not be a good fit for this. Now, we could have a youth, his IQ is below 70, but he's got a lot of juvenile justice involvement. We would call that street smart. You know, he might be a bad influence on the population at Norris. So we've got to protect the youth that we do have. So we might not take those individuals. Now, if it is all the aggression seems to be at home and it seems to be a situational issue, that's something that we will certainly look at. If they have an extensive substance abuse history, like if they need substance abuse treatment, that's not something we're able to accommodate. Now, if they've tried here and there, maybe their peers have taken advantage of them and got them to try something, that's totally fine. But if they actually need that treatment, that's not something we're able to do. If they have a history of sexualized behaviors, you know, typically if they're perpetrating on their peers, that's not something that would be appropriate for us. So that's something we look out for. And conduct disorder diagnosis kind of goes along with the extreme level of delinquency and aggression. And that's a big red flag for us. And again, I know sometimes these kids can be diagnosed with that, and we will certainly look at their behaviors and not just the diagnosis. So these are some of the services that we provide. We've got a therapeutic milieu. Every minute of their day is a therapeutic moment. So, you know, interacting with their peers, their teachers, the staff, family, you know, everything is being looked at. Their behaviors are being measured and worked on constantly. So that's why they're there, of course. We provide individual and family therapy, group therapy. We do have nursing staff 24/7, so we're doing medication management, and we provide ABA therapy, occupational and speech language therapy. So we have 4 units. I think about 3 are open right now. Just like the rest of the world, staffing is an issue for us. We do have 63 beds, but right now we're about 38 residents. So we've got 6 to 12 residents on each unit. They're they're grouped by gender, age, what they need to work on. So that's kind of how we pair them up. And that's where they're living, that's who they're living with, and that's who they're going to school with. So that's what each unit's looking like. We do have on-site school. It's year-round. All of them are special education teachers. We have a sensory room that's lots of fun. There's like a swing in there. There's different things that you can touch, things that can light up. Lots of sensory toys is a big one. We go through lots of toys because they're very big on, you know, feeling that, and kind of helps redirect them when certain behaviors start to come on. And we do have multiple indoor and outdoor recreational spaces. We do have an indoor gym. So, you know, when it rains, they're still able to play. Of course, they can play in there anyways. And UCARU is our, I hate to use the word restraint, but, you know, with this population, it can be very physically aggressive. So we've got to keep staff safe. We've got to keep the kids safe. So I think it's actually UCARU is how you pronounce it. But it's a blocking pad system. Like if you picture an umpire, I don't know if they still use these anymore, but they have like a shield, the ones behind the plate at a baseball game. They used to have those shields, and that's kind of what some of these pads look like. So instead of putting this child in a physical restraint, we're able to just kind of intercede, and you know, maybe they could take their frustration out on the pad instead of their peer. So it's actually reduced our restraints a lot. We've had, I'm almost embarrassed to say the number, but 2 or 3 years ago, we had over 1,000 restraints in 1 year. And we've only had, I think we're about 8 this whole year, ever since we've started it. So it's reduced it tremendously. And it's great for this population. And Humans and Animals Learning Together is another program that we have at Norris. So the youth are working with the animals at the shelters and teaching them basic commands, and kind of helping them be more obedient and possibly, hopefully, more adoptable. So it's very rewarding both for the animals and the children. Children, you know, it's a gain in confidence and self-esteem. You know, look what we've done for this dog, and got them home. And so it really kind of, and obviously it helps the dog get out of the shelter. This is their staff. Of course, there's amazing staff there. You've got to have a good heart for it. There's some that have been there for years, and they do a fantastic job with these youth. I think that's a pajama day. There's more pictures of our staff. We do lots of fun days for the kids. None of these are the kids. This is all staff, but we do lots of fun days, you know, inflatables, and do different kind of festivals, you know, seasonal, and the kids love it. Staff too. So how to make a referral. So we have a generalized email address at referrals.norris@rop.com. You can send it to them, or you can reach out to Brooke, who is our admissions director, or you can reach out to me. We can even talk to the parents. You know, if you don't want to call us, you just want to have the parents call us, that's totally fine. We'll be happy to speak to them. They can come get a tour. You all can come get a tour. We're actually having an open house in October. So if anybody's interested, coming out and seeing it, let me know. It's October 26th. Yeah, that's all your information. Just write it down. You can call me, you can text me, email me. And ROP is our parent company. It's called Rite of Passage. They just took ownership of Norris March 1st. So, but I've been marketing Norris for about 4 years now. So.
Thank you so much, Jennifer. What a great resource to have in our state. Does anyone have any questions for Jennifer?
I was wondering about tuition, insurance, that kind of thing.
Yeah, it is all insurance based. I think maybe one time we've done private pay. Some guy worked for a big company in California when it was able to do private pay. But yeah, we do go through insurance. And like I said, these families have already exhausted their resources, and their insurance would be like, okay, like I see that you've tried, everything possible. Let's try residential and see how it goes. And if for whatever reason insurance does deny, we can help appeal that. We could walk the family through that process too.
Okay. Thank you. Does anyone else have a question for Jennifer?
What is the average length of stay?
We shoot for 3 to 6 months. That can be a little bit longer, but yeah, we definitely try for 3 to 6 months. With this population, we don't want to make it too long. We don't want them to lose hope and think that they're never going to get out of there. So 3 to 6 months. Some of our kids are in state's custody, whether it's Tennessee or another state. So those do tend to get a little bit longer just because, you know, it's hard to find placement for them. But yeah.
Would nonverbal autistic children be a good candidate for your facility?
Yeah, absolutely. Yeah, we do have several that are nonverbal. And we help them with communication, you know, whether it's with a message board or an iPad or some kind of communication device, sign language. But yeah, nonverbal, we even have some youth that are still wearing diapers. You know, we're able to accommodate that, whether we can help potty train them or you know, obviously we'll change their diapers. So that's not an issue for us. And but yeah, a lot of ours are really working with the youth, seeing what they need, and then getting that back to the families and continuing the same processes that we built for that child, because each one's going to be completely different. You know, we don't have a system. It's not like, hey, you got to achieve this status or get that. It's really trying to figure out what works for this youth, whether it's changing how you speak to them, not using this word, maybe not having these colors in their room or these certain lights. But yeah, different coping skills for each child. And some are higher functioning. You know, if we need to work on independent living skills, we'll certainly do that too. Some of them we are able to get on that independent living path.
Okay. Jennifer, thank you so much for sharing this information. Again, what an amazing resource for us to have in the state of Tennessee.
Yeah,
we appreciate all the work that you all are doing over in East Tennessee.
Yes, thank you.
Jesse, would you like to take the floor now and talk about the implementation plan review?
Absolutely. And I'm going to walk away. So online, if you can't hear me, make sure to put something in the chat so I can see. But at the coalition, if you look around the room and who we have online, we have a very diverse group. We have sectors from all over the community, because when it comes to the coalition, we all maintain our own identity and we're all after that same goal. So in short, we try to keep kids off drugs, right? Now, as a coalition, we are funded entirely by grants. And when we use grant money, we have to be good stewards of our money, correct? So part of that is having a process of what are we going to do to tackle the issues in Franklin County. I am in the process of redoing these and I have to send them off to the state for approval. That whole process is doing an assessment and having a plan and getting the data. And then you can come up with your implementation plan. So that's where I am in the process. I wanted to share this with you and get some feedback. If there's an area that we're not doing, or if you have an idea that we haven't done yet, absolutely open to it. That's why we're here together as a group. So when we talk about our implementation plans, this is one grant. This is our bread and butter grant that we get every single year of block funds from Tennessee. But this is just one of the programs that we run. And this grant covers tobacco, alcohol, and prescription drugs. Now, when we talk about tobacco, the big thing right now is we're not catching kids smoking cigarettes. What are they doing? Vaping. And those devices are not technically covered with these funds. Now, we can do some basic nicotine education, which then overlaps that, but these funds are for tobacco. So keep that in mind when we get there. So the first one is prescription drug implementation plan. And when we do these things, we have to target what are we trying to do, because it's broad, right? substance use is so broad, and if we're looking at prevention, we need to narrow our focus a little bit so that we can be effective. So we're looking at non-medical access and perceived risk. Those are the two areas that when we do our youth surveys, those are the two areas that they're saying, you know, like we've got 34% of the student surveys said that they were easy to get. So that's non-medical access. 68% of students have not spoken to their parents about the dangers of non-medical use. And 16% of middle and high school students surveyed think that using these prescription medication not prescribed to them does not pose a risk. So we have to look at that data point to figure out what it is that we want to target, and then we have actions to back that up. Sorry. So then we've got 8 areas that we have to have actions for. So the first one is policy, practice, and procedure. So our goal this year is to create a policy. Now, we're not going to get the policy passed this year. This takes a few years to do, but we want to get this together and start this ball rolling, where we have a system that's a policy in place for when athletes get hurt. So that if they are taking a pain medication, that we are following up with that student, that we're following up with that family, and we are not pushing them to perform when their body is not ready. And then when providing information, this is probably where we spend most of our time, is educating. So we're going to promote Count It, Lock It, Drop It with local media and social media, and coordinate a radio campaign to inform of community arrest and convictions relating to prescription drug offenses. We do this on WCDT with the jail report. Building skills, we're going to provide workshops throughout the community on how to talk to youth about drugs and how to store medications at home. We're doing parent nights next week. That fits into our implementation plan. Provide parenting classes for incarcerated parents and parents court-ordered parenting classes. We partner with Eric and the Campora Family Resource Center to do that, and then provide life skills at the alternative school. Providing support, we provide free lock boxes and training on how to talk to clients about finding the medication and lock them up. And then also we have information at vet clinics, because pets get medicines and those medicines can be abused as well. So we have information at the vet clinics to do the same thing, count it, lock it, and then drop it. When you dispose of it, go to the local police department. We have these in different areas, and we hand them out everywhere we go. We've got them in resource packets, and this just tells people they can call us and get a free lockbox. Oh, the realtors, thank you. In the funeral homes, same thing, where we're providing them information, and for sure with, hey, you have people coming into your home if you have an open house. If you have someone who's passed, what do you do with all that medication? So we're reaching the people to be able to tell the general population what to do with those circumstances. Another big area is increasing barriers and reducing access to the bad things, but then reducing barriers and increasing access to the good things. So in order to reduce access to prescription drugs in the community, we are using the prescription drug disposal program. And that's been established for 8-9 years now, where every police department has a permanent disposal box. And then we have family substance abuse prevention toolkits. There's a box that we get together. We have a lockbox in it. We have education about different drugs. We have tips on how to talk to your kids. We also provide, and I think most of you have seen these, our community resource guide. We hand those out in there as well. We also provide this everywhere we go. We offer it to organizations. So if you work with families and you would like to have these, I will gladly print them for you. So you don't even have to worry about that. We do update this at least 4 times a year. And then there's the directory, the recovery meetings is on here. Another big thing that we do is providing alternative activities for youth. So basically, we provide a safe place for kids to come because bored teenagers equals trouble. That's when they experiment. We don't want them hanging out at the Walmart parking lot. We don't want them going to the park after dark and getting into trouble. So we do everything we can to have alternative events. We go to the Rain every Wednesday. The Rain Teen Center is an excellent partner. They already have a really good attendance. So we provide some prevention programming there. But we've also opened up on Friday. The teens, we started that during the summer when we are maintaining that. So that on Friday nights, they have a place to go. And then we're doing things like fifth quarter. We're doing fifth quarter on the 30th. That's the homecoming for FC. Changing this initiatives and consequences. So part of that is building our coalition. The more people that are involved with what we're doing, the more people we're going to be able to reach. Because our hope is you come in, you hear what we're doing, and then you go and talk about it. And, you know, I get people ask me all the time, well, what could I possibly do to help the coalition? Follow us on Facebook, share our posts, talk about it. Let's get the awareness out. And just literally talking about these issues helps spread that message. So in order to increase our coalition, we are going to have we're calling it a leadership award ceremony, but it's just a banquet. And we will be having that in November, and we'll be having lunch. Believe we've nailed down the livery for that, but I'll let you know for sure in the coming weeks. And then change your physical design. We do things like posters here that we designed about prescription drug safety that we provide to pharmacies. We have pharmacy bags. We have some door stickers, you know, telling people, hey, lock up your medications. We provide lock boxes to the pharmacies that they can give out so that people can lock their medications up. Any comments, suggestions on the prescription drug plan? Okay, moving along to we're on the next. The alcohol implementation plan. So with alcohol, we are focusing on retail and social access. So basically the availability. We know that because we do compliance checks, we do them throughout the county and then each city. And last year, 7 out of 33 businesses, so 21% sold to minors. Or sold to the underage, and that's the compliance check. The only thing the compliance check does is make sure that that clerk is following the law and not selling to someone underage. And if they're failing a compliance check, the chances are that youth are able to gain access at those locations. 64% of the students surveyed did say that they thought alcohol was fairly easy or very easy to get. And 17% of youth that we surveyed said they purchased it from a retailer. So with our policy change, we do want to work with all 7 beer boards. Winchester and the county are probably the most active beer boards. And we, a few years ago, several years ago, all the beer boards were very similar. They became similar in their policies, where before they were very different. And so now our goal is that they require this responsible beverage service training that we offer before they get their beer permit. That is something that the county is doing, and we're working with the cities as well. The other thing we want to work on is the University of the South. Right now, the University of the South has a 2-hour party limit. So you can get a permit to have a party and serve alcohol, but you have to have it, you can only serve it for 2 hours. And I think their mentality is that, you know, we don't want party all night long. But what it's doing is creating an environment conducive to binge drinking. So we want to work with the university this year and see if we can't get that to shift, rather than enforcing 2 hours. Drink as much as you can within 2 hours is not, it's just not healthy. And then providing information. Our website is got a ton of information on it. We keep it updated. Building skills, that's where that class comes in. Providing support. We do things for retailers when we give them this class that we do not charge for. It's paid for with a grant, okay? We provide them with signage. Under 21, don't even try to buy, have your ID ready. If they can't buy it, don't supply it. And then our Parents Who Host is another really good campaign that we have. We offer them these ID calendars. We print these. We create them, we print them, we bind them. It's very labor intensive, but we give them to each retailer every year, and then as new ones open up, so that their clerks have something right in front of them to help them make that good decision on how to identify someone who's underage. Increased barriers to reduce access. We work with law enforcement and they do the compliance checks. We have extra patrols during times like graduation and prom. And then we're increasing access to drug-free alternative activities. We praise and recognize retailers who have passed their compliance checks. And then for physical design, we have things like popcorn bags that we provide to concession stands, and table tents that we can put out at restaurants or different businesses. This one is like that Parents Who Host lose the most. And we have coloring pages, placemats that we offer free to business, to restaurants, that has messaging on it. It's got a QR code that has information on substance on prevention messaging, and then also some games that the family can play together to increase that family unity. Suggestions or comments on the alcohol plan? Anything we're missing or that we could be doing different? Okay. Tobacco. So here it is, retail access and perceived risk. 35% of students surveyed, but so they think alcohol products are fairly easy or easy to get. Tobacco. And you know, we do nicotine classes. And I talk to the youth, where are you getting it from? Now, a lot of them are, I just buy them from my friends. Right. So where are they getting them from? And each class, you know, someone will identify the fact that they can just walk into a store and purchase tobacco products. 47% of middle and high school students surveyed in 2019 so that e-cigarettes poses a moderate or great risk. So that means more than half don't think it's a great risk. And in a focus group that we did, 50% of the students said they knew someone who was under the age of 18 who smoked cigarettes. One thing we want to work on is getting a local ordinance that makes it that will prohibit smoking or any tobacco use in parks. So that takes time. And so that's something that we're going to work on. And then PSA messages, we have them on social media, and we also have some ready for the radio.
There's some hilarious ones on TikTok. If you're on TikTok, go watch it.
Oh, yes, Siggy Sega. You've got, who's not seen our TikTok page? Like, all of you have got to get on TikTok, like right now, and look this up. It is hilarious.
FB. Say that again. FB_PC.
Alan is the star. Dustin's on there. You don't remember these? You got chased by Piggy Price. I think Dustin's got, you know, some PTSD from the sticky pops. Building skills, teaching parent efficacy on teaching them how to identify vape and nicotine products and update them on current trends. That's one of the things we do with the Hidden in Plain Sight. We will have those the Hidden in Plain Sight set up on the parent nights. No? And then Youth Coalition, has a conference of regional training to help develop and all that things, nicotine and tobacco. We're really hoping to get to Tennessee Strong this year. Okay, it's on my plan, it's on my plan. And provide support, training and resources to parents, students, and other community sectors. Oh, just wish I had it right left. I'm sorry. We will provide increased signage, same thing. Same thing as alcohol. This is new this year and provide, and we started it last year, but it was on our plan this year. Where when students or youth are caught with tobacco products and they get sent to court, then we have a tobacco class. And this class has been really successful. Leanne has told me that she hasn't had a repeat offender of the ones who went to my class, which is amazing. And so we do that once a month, and it's a 2-hour, about 2-hour class. And then we also have the in-depth program that we started, and we're working on creating, this is a policy right now. It is promising practice, I guess you would say, in our school system, where the first time they get caught with nicotine, then instead of sending them to court the first time, they're going to send them to the in-depth class, which is an evidence-based class. It's 4 1-hour sessions, but we're doing it all together on a Saturday. And we work with them on education, and then we also talk to them about quitting. So it's not a sensation class, but it helps that process of change happen and give them some options and some support when they're ready to quit. So we did one at the end of the school year, and then we just finished one this month, and that's something that we're going to hold every month. And the school administration is really excited about it. The other thing that we're doing is getting into the schools to do Aspire, which is another evidence-based program. It is self-led on the computer. It takes about 3 to 4 hours to complete, and it's straight prevention. And it's something they can relate to. It's kind of like a comic, cartoonish thing that really gives good education and helps them with some of that situations that they get presented with. Again, we recognize stores who pass the compliance checks. Now, where alcohol compliance checks are done locally, the state, the Department of Agriculture does the compliance checks for nicotine and cigarettes. Signs. These are some samples of signs that we provide. Should see them in our park. We go and check them out about twice a year to see if they need to be updated or replaced. No smoking, no vaping stickers in restaurants, hotels. I don't have a sample of that to show. But yeah. Other things that we've done is these resource packets. We want to get the information to the people who need it. So in this resource packet, there's information on Lifeline, there's a medication lockbox coupon, there's information on Narcan training, there's the resource list, and these are given out to EMS and first responders, law enforcement to carry in their vehicles. So when they respond, let's say they respond to an overdose and the person does not want to go to the hospital, or there's people that maybe they go and there's other people that are still there, they can leave a packet. So at least the person has the information, and when they choose to get help, they know who to call and it's right there. So that's something we started this summer. It's been very well received.
Also, everyone getting out of jail.
Everyone's been out of jail.
We give them a.
Excellent. Excellent. So we try not to be hidden. We're trying to get our name out there in the programs that we do so that we can help the people that need the help. Questions, comments, concerns?
What comment?
I have a question, Jesse. What grade level is the Inspire for?
Primarily middle school. It goes like 14 to 17, but it's well received in middle school.
Okay, and if a school wanted a tobacco program or an education, program, like with Siggy and your other materials? Did they just need to reach out to you? How do they get a request to you?
Yeah, they just give us a call. We've been out in the school last year, but I think we hit all of them. With, well, not the high school, we hit all the middle schools with information, on nicotine. So all they have to do is give us a call.
Is this as well as elementary as well?
Yes, I don't get the same education to elementary just because it just gets a little sticky. The Aspire program isn't made for 5th grade. They're just in a different spot. 4th and 5th grade is where we start to do some of this education, but we don't want to introduce something they're not already in. So just, it would have to depends on the needs of the school. We'll work with it.
All right, thank you.
The Red Ribbon Week to most of the elementary schools anyway.
Yeah.
All right.
Was if you see anything up here or anything that you talked about that you would like at your business, if you need lock boxes that you want to give out to your clients, Bennett is amazing partner with us. She'll be calling me like, I want some stickers to put on my stuff. And I'm like, okay. So they put stickers on cups about tobacco. They put stickers on, if you ever get their chicken salad to-go boxes, they put stickers on them. They put stickers on their water bottles. Anything we give her, she helps get it out in the community. So if there's anything that your company would like, we would be more than thrilled to get you something to help get the word out.
Absolutely. Can we vote on if I can present this, our plan to the state as written? All
Yes.
agree?
Yeah.
Any nays? Okay. Thank you, that passed.
All right, thank you, Jesse, for all that hard work you put into that. Appreciate all the efforts that's happening in Franklin County in prevention. At this time, we will talk about our upcoming announcements and events that's going to be happening. So Melanie, if you're ready, we'll start with your slides. I have the agenda in front of me, but I'm not sure which one of yours is going to come first, so I'll wait.
Sorry, I was.
That's
talking about-
okay. I'll tell you what, I'll go ahead and start. We have Zumba on Tuesdays. Well, we're going to have the QPR training. That will be on September the 20th at 6 p.m. at the Cumberland Presbyterian Church. So if you're interested in that, who's conducting that training?
Alan.
Okay, so get in touch with Alan Burnett on that one. Okay, next. Oh, Recovery Alive, Hope for Walk 2022. That's going to be September the 24th. I think that is being done by our recovery court there in Franklin County. So anyone interested in participating in that needs to contact Caitlin Barstead. Dixie Sims is going to be at Camp Rain. The Sims family will be providing music out there. Looks like horse rides, animal farm, bounce houses. So anyone interested in going out to that event, that is going to be on September the 24th from 4 to 8 p.m. Tennessee Save a Life, Community Opioid and Stimulant Training, September the 29th. Anyone interested in that or promoting that program, please get in touch with Dustin Ritchie. And looks like, is there anything else there in person that anyone needs to add or online?
I do want to add one more thing.
Go ahead.
Thank you. Dustin Ritchie got approved to be our regional health council representative. So he's going to be representing Franklin County.
Oh, well, congratulations, Dustin. We appreciate that. Awesome. Anyone else?
The library has some events coming up.
Okay, go right ahead.
Okay, on September the 22nd from 9 to 11 is the chamber mixer here at the library. That's this Thursday. In October, We have the Historical Society program at Falls Mill, October 16th at 2:30, and it's going to be about the Washington Press. That's the wooden press that used to be in one of the old newspapers here in Winchester in the early 1900s. It's been restored. The Trail of Tears Walk is October 22nd. The National Friends of the Library Week is the 16th through the 22nd of October. The Seed Library, the Garden Club, they'll be collecting seeds from October 17th through the 22nd. And on the 29th of October, we have Stories to Songs. That's our new workshop, songwriting workshop, and it'll be Randy Fincham from 10 to 12. That's Saturday.
Thank you so much.
You're welcome.
All right.
Miss
Jesse,
Tabitha?
now, yes.
Hey, this is Mary Ann. I know that it's a little far off, but the South Central Regional event for September as recognizing Suicide Prevention Awareness Month. Our event is this Saturday, 24th, the same as the Recovery Walk, but it's a 5K trail run and a 1 mile memorial walk. It's in Bon Aqua at Johnny Cash's old ranch. So if anybody would love to do that or help me spread the word, I would appreciate it. And I would love to see everybody there. But I also understand that it's a little bit of a drive and you're having your own recovery walk.
Thank you. Anyone else?
I do. Just real quickly, first of all, some guys think referrals for the child and adult and dealing with any type of mental health and behavioral health concerns affecting their daily life. Our services are entirely free for the family, so anyone knows anyone that can use those services, they can get with me. I'd love to share some info with you. And Tennessee Voices is putting out a app called My Health Line. My Health Coach. It's kind of like a little free, short little mental health screen you do on yourself. And then kind of gives you some suggestions and things you can do, and also offers a lot of different resources and ways to further do a deeper screen, things like that. So got flyers on both of these, anybody gets.
Will you send that to us with the description, and we'll include that next month in the newsletter? I think we had a demonstration on that app during our youth conference, and it's pretty cool. It's nice little check. So
If anybody has events, they would love to get out there. If they'll send them to us, we will definitely help spread the word.
All right. Well, looks like the next meeting will be October the 17th at 12 p.m. I know it will be held there at the Campora Family Resource Center, and information will come out regarding for everyone who will be joining virtually. So can I get a motion to close out the meeting?
Pat moves.
All right, so we've got a motion, and all right. Well, we look forward to seeing everyone on October the 17th. And thank you, and you all have a great rest of the week.
Thank you.
You're welcome. Thank you for coming.
It was.